I'd like to talk about our trials of screening to identify and eradicate Helicobacter pylori infection in teenagers in Japan. This is my COI. H. pylori infection is epidemiologically related to several gastric diseases, such as gastritis, gastrointestinal ulcer, gastric cancer, and gastric maltolymphoma. Gastric cancer is one of the common malignant neoplasms in East Asia, and about 50,000 persons die of gastric cancer each year in Japan. Recently, it has been confirmed that H. pylori infection is a significant risk factor for gastric cancer, epidemiologically, experimentally, and clinically. This has been proved by experiment using animals and also by randomized clinical studies showing that eradication therapy of H. pylori reduce the occurrence of gastric cancer. In 203, Nozaki et al. Reported that early stage eradication of H. pylori was more effective in reducing the occurrence of gastric cancer compared with late stage eradication in animal experimentation. This slide shows Nozaki's study. He gave a carcinogenic substance, nitrosourea, to Mongolian gerbil for 10 weeks. After that, infected H. pylori for them. Further, he eradicated H. pylori after 5 weeks, group A, 25 weeks, group B, 45 weeks, group C. Mongolian gerbil of group D were not received eradication therapy. The occurrence rate of gastric cancer were 6.7, 27.3, 38.2, and 56.3%, respectively. Group E was a carcinogen substance only. Group F is H. pylori infection only, and Group G was control. From this data, eradication of H. pylori is thought to be beneficial for the prevention of human gastric cancer, and it is more effective to treat H. pylori infection in young people compared with old people. Furthermore, H. pylori-related diseases, especially complicated gastrointestinal ulcer, which can cause death and emergency operation because of perforation or bleeding, can be prevented by cure of H. pylori. The purpose of this study is to collect data regarding the screening for H. pylori infection in health screenings in school, and to identify the actual effects of H. pylori infection in Japanese teenagers. We have proposed that a screening for H. pylori infection should be introduced into health screenings in school, and have performed this procedure in one Japanese high school every year since 2007. The data was approved by the Ethics Committee of Shinshu University School of Medicine. All students of the second year in high school were annually examined about the status of H. pylori infection using urine-based rapid test kit, Rapiran. Students were between ages 16 and 17. This picture shows Rapiran. This slide shows participation rate of high school students in the first screening examination of H. pylori infection. Between 2007 and 2015, 99.7% of students received a first screening examination. This slide shows positive rate of high school students in the first screening examination of H. pylori infection. 3.8% of the students were positive for H. pylori, and the remaining students were negative. The first screening positive students and their parents were recommended to receive further examination of the status of H. pylori in medical institutions by a school doctor. The study who visited to Shinshu University Hospital were performed EGD and taken biopsies to examine the status of H. pylori infection using culture and immunohistochemical test with anti-H. pylori polyclonal antibody after written informed consent. H. pylori infection was deemed to be present if either or both tests were positive, and absent if both tests were negative. Further, result of the ureablast test and a test for serum anti-H. pylori antibody, if necessary, to confirm the infection. This slide shows condition of students who visited medical institution for further examination of H. pylori infection. 93 of 162 students visited to Shinshu University Hospital. 91 of them underwent further examination using EGD, but the remaining students declined to undergo EGD. Other 10 students consulted other medical institutions, and the remaining 59 students were non-response. The slide shows positive rate of further examination of H. pylori infection. 85.7% of students who underwent EGD were infected by H. pylori, and the remaining 13 students were not infected. However, serum anti-H. pylori antibody showed positive in 3 of the 30 students without H. pylori infection. This slide shows symptoms of 78 students with H. pylori infection. Abdominal pain was most common symptom. However, 65.4% of students had no symptom. The most common endoscopic appearance was nodular gastritis, recognized in 88% of the students with H. pylori infection. Endoscopic finding of atrophic gastritis were found in 61.5% of these students. The endoscopic degree of atrophic gastritis, according to Kimura Takemoto classification, was the closed type in all 48 students. 9 of the open type atrophic gastritis, which is thought to be advanced atrophic change compared with closed type. A scar from duodenal ulcer was present in 7.7% of the students with H. pylori infection, and duodenal erosion was observed in 5.1%. On the other hand, normal endoscopic findings were present in 10 of 13 students without H. pylori infection. However, endoscopic findings of open-type severe atrophic gastritis were identified in 2 of the remaining three, who were also positive for serum H. pylori antibody, despite no active H. pylori infection. Type A gastritis was ruled out because these students showed negative result for anti-parietal cell antibody and did not have hypergastrinemia. These 3 students were thought to have had H. pylori infection in the past and have rapidly developed atrophic changes caused by H. pylori infection. Case 1. This is a This is a nodular gastritis, and this is an erosion of duodenal erosion. This student was complaining of abdominal pain since several years ago. After cure of H. pylori infection, his symptoms had disappeared immediately. This picture shows nodular gastritis and atrophic change at the lesser curvature of the gastric body. This picture shows duodenal ulcer scar. Duodenal ulcer scar. Arrow points to a deformity of the pyloric ring. This picture shows histological findings of biopsy specimen, which is infected by H. pylori. Inflammatory cell infiltration and focal atrophic changes were recognized in all 78 students with H. pylori infection. Only 2 students had intestinal metaplasia. The susceptibility of H. pylori to clarithromycin, metronidazole, and amoxicillin was assessed by modified agar plate dilution method. Clarithromycin resistance was present in 37.8% of the students with H. pylori infection. Metronidazole resistance was present in 36.5%, and 29.7% was dual clarithromycin metronidazole resistance. No amoxicillin resistance was present in any students. After informed consent, eradication therapy was performed. Students with H. pylori infection that was sensitive to clarithromycin received clarithromycin-based triple therapy for 7 days. On the other hand, if H. pylori had resistance to clarithromycin, using metronidazole-based triple therapy was performed, whether or not H. pylori had resistance to metronidazole. The decision of H. pylori was assessed more than 8 weeks after treatment by urea breath test. All 75 students except 3, 96.0% with H. pylori infection were successfully cured by the first eradication therapy. Other 3 students were cured by the second eradication therapy. Remaining 3 students have not yet been accessed the cessation of H. pylori infection. No remarkable complications related EGD, including taking biopsy specimens, were recognized in any of the 91 students who received EGD. However, skin rash was observed in 7.7% of the students who received eradication therapy for H. pylori. 3.8% of them complicated of slightly diarrhea. No student was suspended to take medicine of eradication therapy due to adverse effects. The cost of the first screening using Lapiran was $6.36. The cost of further examination and treatment, including endoscopy, had eradication for H. pylori was $366. This slide shows cost of first screening, further examination, and treatment of H. pylori infection in the nationwide health screening of high school students in Japan. 1. Population of 1 year generation in present Japanese teenager is 1,210,000 persons. Cost of the first screening examination for H. pylori infection is $7,700,000. 3. Positive rate in the first screening examination for H. pylori infection is 3.8% from our data. The number of students who require the further examination for H. pylori infection is 45,980 persons. 5. Cost of further examination and treatment of H. pylori infection is $16,845,400. Total cost is about $25,000 million. This slide shows expected cost-effective of the prevention of gastric cancer by curing H. pylori infection in teenagers. 1. The rate of persons with H. pylori infection who will suffer from gastric cancer in their lifetime is 14.8%. This data was calculated using Uemura's cohort study. 2. The number of persons with H. pylori infection who will suffer from gastric cancer in their lifetime is 45,980 persons. 3. The rate of persons who will be prevented against suffering from gastric cancer by curing H. pylori infection in teenager is 80%. This percentage estimated based on the result of an experiment using an animal model, which have been reported by Nozaki, which had been shown. 4. The number of persons who will be prevented against suffer from gastric cancer by cure of H. pylori infection in teenagers is 5,444 persons. 5. Cost of the prevention of gastric cancer each person is about $4,500. This slide shows simulation of cost-effective calculation on the assumption that the urea breast test would be used for further examination of H. pylori infection, and that the eradication therapy would be performed using a metronidazole-based regimen as a first-line therapy. The cost of the first screening using Lapiran was $6.36. The cost of further examination and treatment, excluding endoscopy and eradication therapy for H. pylori, was $126. Cost of further examination and treatment of H. pylori infection in the national-wide health screening of high school students in 5,797,660. 2. Total cost of addition the first screening examination of H. pylori per year is $13,400,000. $97,660. 3. Cost of prevention of gastric cancer for each person is about $2,500. Summary. 1. The rate of prevalence of H. pylori infection in Japanese teenage is 3.8% at present. A very high participation rate of screening examination for H. pylori infection using urine-based rapid test kit was achieved in high school health screening. 3. Most common endoscopic findings for students with H. pylori infection are nodular gastritis and closed-type mild atrophic gastritis. Clarithromycin and metronidazole resistance were present in 37.8% and 36.5% respectively. On the other hand, no amoxicillin resistance was present. 4. If this procedure was introduced nationwide, the cost of the prevention of gastric cancer would be $4,500 per person. Conclusion. The low rate of prevalence of H. pylori infection in present Japanese teenager make it possible to perform this nationwide plan from a viewpoint of medical economy. Further, the occurrence of H. pylori-related diseases such as gastritis, gastroduodenal ulcer, and gastric maltonyphoma will be reduced in their lifetime simultaneously. Thank you for your attention.